Next, we're going to look at the arrangements of organs and muscles of the abdominal wall at the axial views. First at the Visible Human project and then at the CTs. So let's begin. Let's identify the muscles of the abdominal wall at this HV dissector image. You see two recti abdominis muscles anteriorly here with the linea alba between them in the middle, and three flat muscles on both sides. They are the muscles of the anterolateral abdominal wall, the external oblique, internal oblique, and the transversus abdominis. Posteriorly here you have two muscles of the posterior wall of the abdomen. They are the psoas major muscle and the quadratus lumborum. Everything what is behind then the quadratus lumborum belongs to the erector spinae muscle. Absolutely same muscles are visible here. The rectus abdominis on the right and on the left with linea alba in the middle. The external oblique, internal oblique, transversus abdominis on both sides. The quadratus lumborum posteriorly here, and the psoas major, the round-shaped muscle just in front of it. So you see the picture is almost identical. Now let's try to identify the main parts of the GIT. Behind here you have the esophagus and descending aorta. The spleen is located on the left side here, and the liver is on the right. You remember we have the reversed right and left localization of organs on our images, and the hollow organ which is between them right here is our stomach. And you see how beautifully the esophagus enters the stomach right at this level. This is the cardiac level, where we have the gastroesophageal junction. As we descend further down, we can see the body of stomach with the greater curvature in front and the lesser curvature behind. The yellowish tissue which is attached to the greater curvature is our greater omentum, and the one which is behind it is the lesser omentum. And as I descend down, I can see the pyloric antrum, the lower part of the stomach. Here it is, and it continues with the pyloric canal, the narrow part which leaves the stomach in this region. Let's follow it further down. The pyloric part, it continues with the duodenum. The first part of the duodenum is right here. It continues with the second part, the descending duodenum, just below, and then it turns medially into the third part of the duodenum. Here it is. This is the horizontal part which crosses the midline and turns to the left to continues with the jejunum. The loops of the jejunum appear all the way around on the left side of the image. The same organization all the structures have on the CTs. You see the esophagus running down just in front of the descending thoracic aorta. As soon as esophagus pierces the diaphragm, right now it opens into the stomach. Here we are at the level of the gastroesophageal junction, and you see the body of the stomach with the greater curvature and lesser curvature, with the greater omentum and lesser omentum in front and behind. You remember the fatty tissues are usually hypointense on CT images, so they are dark in color. As I descend further down, the pyloric antrum appears. It kind of crosses midline and turns to the right and going closer to the liver, which is on the right side. Now you see how the pyloric antrum continues with the pyloric canal. The part of the GIT which continues down is the first part of the duodenum, which goes down as the descending, the second part of the duodenum, And as I follow them further down, I can see how they turn medially and continue with the third part of the duodenum, that is the horizontal part of the duodenum. Here it is. Well, the horizontal part of the duodenum, it continues with the jejunum, so all these loops on the left side of the image, which are intensively supplied by the branches of the superior mesenteric artery, they belong to the first part of the small intestine, the jejunum. Well, the last part of the GIT in our agenda today is the large intestine, and we're gonna find all the parts of the large intestine on the images. And the highest part, which appears right now on the left side of the image, is the left colic flexure. You see how close left colic flexure is to the spleen. That's why it is also called the splenic flexure sometimes. The anterior part of this flexure, it continues with the transverse colon, while the posterior part, now you see it here clearly, it becomes the descending colon and it descends down to continue with the sigmoid. Well, now please focus at the transverse colon, and you're gonna see how it moves from the left side to the right and finally joins the counterpart from the right side. Well, if I return a little bit back here, just under the liver, you can see the hepatic flexure or right colic flexure, and the same situation is here. As I scroll a little bit down, you see the hepatic flexure. It divides into two parts, the transverse colon anteriorly and the ascending colon posteriorly. If we follow the ascending colon down, you're gonna see how it increases in diameter and becomes the cecum. Here it is. This is the cecum. The part of the small intestine which is close to the cecum is ileum. You see it's much thinner. The wall is thinner and the lumen is thinner as well. And on the left side, on the opposite side of the image, you also can see how the descending colon continues with the sigmoid colon, which is right here, this beautiful loop of large intestine which kind of descends down to the pelvis, is our sigmoid colon. Well, as soon as you see the heads of the femur on both sides, the hip joint, the sigmoid colon becomes a rectum. So this part of the intestine posteriorly here is the rectum, and the rectum continues as far as the pubic symphysis. As soon as you see the pubic symphysis in front, the rectum changes the name. Now it is anus. So if this part of the GIT is pinned, you should answer the anus. Same localization all these parts have on the CT. So we do expect to see the left colic flexure first on the left side of the image, and here it is. This is our left colic flexure, and as I descend down, you can see some micro air bubbles inside, which indicate the appearance of the stool inside of the large intestine. And you see the posterior part of this loop, it descends down now as the descending colon, while the anterior part, it runs horizontally to the opposite side of the abdomen. You see these air bubbles all the way in front here, running toward the liver. Just in the close proximity to the liver here, you see the hepatic flexure or the right colic flexure. This is the right colic flexure, and it splits into two departments, the ascending colon posteriorly here and the transverse colon just in front. As I scroll down, I easily can identify the ascending and descending colons here because of the stool inside, the very typical appearance of the stool. And I also see how ascending colon becomes wider and continues with the cecum on the right side of the image. The lower part of the abdomen is filled by the loops of the ileum. So this part of the small intestine is ileum. It opens into the cecum at the ileocecal junction, which you see right now here. And you even can see the appendicular process on this image. Have a look, this tiny guy here is the one. Well, as I scroll further down, I see how the descending colon on the left side, how it runs down and makes a loop here. And you remember, as soon as we have the hip joints on both sides, here they are, we can identify the rectum. So this part of the GIT which we have here is the rectum, and it continues till the symphysis pubis. Now we do not have rectum anymore, but we have the anus. In the alive patients, the anus is closed because the muscles which we have here, the internal and external sphincters, they have some tone and contract. Okay, that's probably all for today. You have plenty of tasks to handle. I'm attaching some images after my record so you can practice and try to identify the structures yourself. Good luck with that.